nasopharyngeal airway insertion and bag valve mask reservoir ventilation. Step 1. Determine the need for nasopharyngeal tube or airway insertion. Step 2. Ensure that BVM is correctly assembled. Attach BVM to oxygen cylinder and open oxygen cylinder to 10 to 15 liters per minute. Select the correct size nasopharyngeal tube by comparing the outer circumference of the nasopharyngeal tube with the inner aperture of the nares, or measuring the external nair to the tragus of the ear. Lubricate with water-soluble lubricant. Step 3. Insert nasopharyngeal tube with the bevel away from the septum into the largest nostril. Advance gently. If resistance is encountered, rotate the tube to facilitate gentle advancement. If resistance cannot be overcome, remove the tube and attempt the other nostril. If resistance is encountered in the second nostril, rotate the tube to facilitate gentle advancement. If resistance cannot be overcome, remove the tube and abandon the attempt. If no resistance, insert the nasopharyngeal tube until the flange or the safety pin is flush against the patient's nose. Step 4. Ventilation. Position yourself directly above the patient's head. Perform a head tilt chin lift. Place one hand on the patient's forehead and push with your palm and tilt the head back. Place the pointed end of your BVM mask over the bridge of the patient's nose. Clamp the mask to the patient's face by forming a tight seal. Compress the bag until chest rise is observed. Ensure correct rate of ventilation, 1 ventilation every 5 to 6 seconds for adults, 1 ventilation every 3 to 5 seconds for infants and children.